Hi folks, my name is Dr. David Cullen. I was diagnosed with a hiatal hernia when I was really young. My first year getting my doctorate program, I was late for class and the teacher made an example out of me, and I explained to him that I had really bad GERD and I tossed up my lunch basically. He made an example out of me, brought me up in front of the class and actually did an osteopathic maneuver pulling my stomach down. And if you understand acid reflux and GERD, which I'll explain in a second, it makes sense. After that, it completely went away. I hadn't had a problem for about 10 or 15 years. And then I had the problem again and I did the maneuver again. Now, for the past 25 plus years, I've been treating hiatal hernias, patients with acid reflux and GERD with this osteopathic technique with an 85% success rate. That's a higher success rate than omeprazole, antacids, and way higher than the surgery for hiatal hernia. So let's get into acid reflux and GERD. So there are other symptoms associated with a hiatal hernia. So acid reflux and GERD are the most common and the most uncomfortable, but also people get chest pain, typically in the middle. They also get nausea, bloating, gas, burping, a lot of burping after eating, a globus, like a pit in their throat, or they feel like they constantly have to clear their throat, especially at night with a lot of phlegm or a chronic cough at night when they lay down especially. But it can also cause heart rate issues, so heart palpitations, panic attacks even, and anxiety. Not to mention all the other stomach related symptoms. And the reason for this is the stomach herniates up through the diaphragm, creating a hiatal hernia. And that compromises the lower esophageal sphincter, which is the trap door that keeps the acid down below in the stomach. So now that's compromised because it's herniated up through the diaphragm and it can't open and close properly. There's pressure on it. Furthermore, you have a vagus nerve, two vagus nerves that run up through that hole in your diaphragm. And when the stomach herniates upward, it puts pressure on the vagus nerve. And as you know, the vagus nerve controls heart rate variability as well as acid production, and it controls the motor function, the muscle function of the lower esophageal sphincter. So you can see how a hiatal hernia, when the stomach slides upward, how it can cause a whole host of strange symptoms. So I've created a device that mimics the technique that I've been using successfully for over 25 years, and that's called the Reflux Shield. It's a great product with an over 85% success rate with a money-back guarantee. Try it out today at refluxshield.com. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.